Hello and welcome to Gray Matter, your one stop for all your exam preparation needs. So this is the part two of the series that we have started. We are discussing the roadmap of the UKMLA. So today the topic is cancer. To be honest, I don't think any specific presentation or any new condition is added because cancer, in one way or another, all the topics in cancer have they can it can come in any way. The cancer is such a topic that it can present in any way. Basically, all you have to follow is the rule of flaws. For those who don't know, you have to ask the symptoms, the fever, lymphadenopathy, the appetite, how's the appetite, the weight loss. So these are the symptoms that you have to ask, and if they are positive, then there is a suspicion of cancer. So, they can present like a patient can present with any of the following presentations, and you have to, after taking the complete history, ask the flaws. If the flaws are positive, one of the flaws are positive, then there is a high suspicion of cancer. So think about cancer. So that's why not many topics are like I'll try my best to tell you of any new topic that hasn't that didn't go through my eyes before. So I'll tell you about it. So abdominal distension, that is a very common topic. Abdominal mass, common topic. These two can present in the form of examination stations. Acute and chronic pain management, we have talked that before in the previous videos. SITs, again the abdominal examination. Bleeding from lower and upper GI, again it's we have discussed it. Bone pain, now that is also a common station. It can present in a normal station. Breast lump examination station. Breathlessness, we have discussed it before. Cough, we have discussed it before. Change in bowel habits, now change in bowel habits, this is also a common presentation of cancer. Decreased appetite, it's part of the flaws. Electrolyte abnormalities, we have discussed it. Fatigue, now we have discussed it. Fatigue is also a very common station. So hematuria, hemoptysis, whenever there is any blood from any orifice, so that is a very alarming situation, because blood coming from any orifice is not the right thing. So you have to examine and investigate it. So that's why these are alarming situations, and it is a common presentation of cancer. And headaches, we have discussed it. Jaundice, some liver problem can present with jaundice. Limb weakness, now limb weakness, I guess I haven't gone through any scenario, so I'll mark it as a new presentation that can present with cancer. Lump in groin, we have talked about it. Lymphadenopathy, any number of cancers, most of them present with lymph surrounding lymphadenopathy. Neck lump, I haven't gone through any scenario that involved lumps on the neck, but it in the medical terms, and the neck lump is a very common scenario, but it was I haven't gone through it previously in the PLAB roadmap. So in the UKMLA, they are focusing on the neck lump presentation. And the pain on inspiration, I haven't gone through scenarios or heard about scenarios that involve a cancer presentation like this. So focus on this. Painful swollen leg, that is a common presentation. Pelvic mass, common presentation. Pleural effusion, common presentation. Testicular cancer, we have discussed it. Swallowing problems, now this can be an esophageal cancer. So this is something new. So I haven't gone through it. I haven't encountered such scenario before. And weight loss, that is a common presentation in all cancers. Now we're going to talk about the conditions. So almost all of the conditions have been previously reported. Basal cell carcinoma, very common. Bladder cancer, very common. Brain metastasis, very common. Breast cancer examination station, very common. Cervical cancer, very common. Now, colorectal tumors, I haven't gone through any scenario that involves colorectal, so please, you can study it. Endometrial cancer, that is a common station. Gastric cancer, even though it is a very common medical scenario, but I haven't seen it in the uh, PLAB roadmap. So hypercalcemia malignancy, that is a common important station. Leukemia, a very common station. Lung cancer, very common station. Lymphoma. Now, I haven't gone through any scenario that involves lymphoma in the previous roadmap. So this is something that you can, revise or study. And malignant melanoma, it is a very common important station. Metastatic disease, common station. Multiple myeloma, common station. Esophageal cancer, as I told you, the swallowing, difficulty in swallowing, that can involve esophageal cancer, so I haven't seen it before. Ovarian cancer, a very common station. Pancreatic cancer, I haven't seen any scenario before, so this is a new station. Pathological fracture, that is a common station. Patient on anticoagulant therapy, that is a common station. Prostate cancer, that is a common. Spinal cord compression, squamous cell carcinoma, and testicular cancer, all of these are common station. So basically what I want to tell you is the pattern. Don't be afraid that what is UKMLA. I am worried about what are the changes, how they are going to change. Everything is the same. They are going to mark you on the same pattern that we have discussed before. They are going to judge you on the same pattern that we have discussed before. The only thing that's changed is the topics. That's why I'm making all of these long individual videos of topics, so you know which topic to prepare and which topic you don't have to waste your time on, because there are round about nearly almost 6 to 700 scenarios. 700 scenarios are a lot of scenarios, and trust me, it takes a while to go through them. So don't waste your time on useless scenarios that are not going to be, you're not going to be judged on. So best of luck. I'm going to leave it here and come back with another video on another of the categories and the topics that are included in the categories. Please like, share, and subscribe, and I hope it helps with your examination.